Hello, everyone. Welcome back to the Meet the Members series. Today we have with us Qida. So please, could you introduce yourself and tell us what your company does?
Hi, good morning, everybody. My name is Roel Spee. I'm the Vice President of Marketing at Qida. Qida is a social impact company born in 2018. And Qida has the vision to make health and social care systems sustainable on a global scale by helping people in situations of dependency and or chronic illnesses to live longer and with a higher quality of life in their homes. Okay, this vision is based on a double mission where that guides us every day. On the one hand, we have what we call our triple M. We want more people to live more time with more quality of life in their homes, right? And on the other hand, we want to restore the social status of the caregivers, promoting their training, their community, and their working conditions as well. It's very important for us that we have both of these missions that we want to work on. So that's what Qida does.
Okay, sounds great. So what makes your company stand out from the others?
So Qida does a couple of things different. We characterize ourselves by carrying out an assessment at the beginning of every service by a care coordinator. And the care coordinator is a very important person that is in contact with both the user, the family, and the caregiver. And before we start any work with the family and with the user, we build a plan which is an individual work plan. That work plan is a social health diagnosis on what the status is of the patient and the family. This plan is very important to us, and it is not just that we do that in the beginning. We also do and update this plan during our current service with the family, right? So that we see the progress of the patient and we see the progress of the family. Apart from that, what I think stands us out from the rest is the fact that we have a good relation with the public-private healthcare, in the sense that when we see that the patient is going very well, is getting better, for example, we update this individual plan, and we also coordinate with the public health system. In that sense, our caregivers in the homes of these people are actually the eyes and ears of what the doctors in the hospitals could have, right? So that we pass all of this information back to the family doctors as well, so that they have more information. We can reduce costs, we can reduce hospital visits, and we believe that these people want to spend more time at their home, because if we ask them, they always say, we want to spend more time at home with a good caregiver next to us.
Okay, sounds awesome. So going to the next question. What has been your company's biggest success or failure?
So the biggest success I would see is still to come. We're still 1% done as Qida. But what we see is that we have a problem with the current healthcare system and its sustainability, right? In 2050, we see that 32% of the population in Spain will be over 65 years old. And that means that the whole health system is going to be unsustainable and needs to find better solutions on how we can improve the quality of life of these people. So we believe that having caregivers in their homes is one of those solutions, right? It's not enough for us to just make the system more sustainable, but we really want to have expert, humane, quality services, because that's very important for us, that are committed all around integrated care, where the customer or the user is the central of the whole health and social system, and where we can find cost-effective models on actually giving service to all of these people. We need systems like this in the future as our population is getting older. So we see success if we can kind of help this transition, and if we can help as many families and people as possible to live longer in their home. And the second point of success is the social impact that we have. We can do this because we have the backup of social impact investors like CREAS, Ship2B, and Fondo Bolsa Social, as well as the support of Banco Sabadell from their B Startup program, and other collaborations with DKU and Adeslas, for example. So we define success there as well, and we want to also say thank you for believing in the transformation of the healthcare system to all of our investors that want to create this social change in the healthcare system.
Perfect. What made you join Barcelona Health Hub?
So technology is very important to us, because in order to have a full picture of a certain family or a certain patient, we need to have the technology that provides all of the right data, and it can also send the data back into the different systems, right? So we're talking about social, but also healthcare systems that all have different types of technology and different languages of technology, right? And with our system of a caregiver in the home, we really believe that the combination of the human and eyes and hands in the house combined with the technology can really, what I said before, can really transform the industry and avoid unnecessary costs in the system, right? Technology is there as the kind of the bloodline through the whole system, in order to integrate all of these systems and have information in the right place, in the right time, when the patient needs it, when the doctor and the public system needs it, when the caregiver needs the information, and when the family also needs information on how their relative is doing, right? So that's, technology is information for us, and it is very important to have all of that integrated around the patient.
Yeah. What do you expect from Barcelona Health Hub towards the future?
So we completely agree that it's very important to connect all of these different companies that are working in this area. We know that we can learn from each other, that we can exchange ideas, that we can debate on certain issues. And we very much welcome the fact that Barcelona Health Hub is promoting and pushing this sector forward. We see it as a meeting point to share innovations and different visions on the future, and how we can jointly, with other companies, build a health and social system that is more sustainable, in which technology, again, plays a very, very important role.
Yeah, I think it's a great opportunity to meet this ecosystem and make new connections. Okay, so is there anything else you'd like to tell us that we haven't asked you?
I just want to thank you all for the attention, for all of the audience. Thank you for Barcelona Health Hub for inviting Qida into this series. We have a great ambition. We're only 1% done, and anybody interested in our journey, I would welcome you to go to our website, qida.s, or connect with us on all of the social media that we have. And get in touch with us if you want to see more information on how we are trying to change the social and healthcare system in Spain, whether that is from a personal interest, whether it's a family that you think might need a caregiver, or whether it's actually people who are interested to work as caregivers for us. All of these interesting audiences are welcome to connect to us, and I'm very much looking forward to speaking to all of them.
Okay, so it was a pleasure having you.